if you can guess what that is.
Denied? You're denying my claim? Oh, I don't understand. I have full coverage.
I'm sorry, Mrs. Wilkinson, but our liability is spelled out in paragraph 17.
I don't pay for this.
That does sound very familiar. Getting denied insurance for something that was arbitrarily inserted into the fine print is a common practice today, especially when the capitalistic insurance companies knew full well that the average American wouldn't be able to articulate those documents, and they know that they won't be able to find those hidden fees, or in this case, a complete denial of one's insurance. Now watch as Mr. Incredible saves this old lady from the tyranny of the private insurance company, which is misleadingly called Insuracare.
All right, listen closely. I'd like to help, but I can't. I'd like to tell you to take a copy of the policy to Norma Wilcox on Norma Wilcox, WILCOX on the 3rd floor, but I can't. I also do not invite you to fill out and file a WS 2475 form with our legal department on the 2nd floor. I would not expect someone to get back to you quickly to resolve the matter. I'd like to help, but there's nothing I can do.
Ooh, thank you, ma'am.
I'm sorry, ma'am. I know you're upset.
Indeed, that was a good one. But watch as his boss, a capitalistic, greedy bastard, walks in to chastise him.
You authorized payment on the worker policy?
Someone broke into their house, Mr. Hobbs. Their policy clearly covers it.
I don't want to know about their coverage, Bob. Don't tell me about their coverage. Tell me how you're keeping Insuracare in the black. Tell me how that's possible with you writing checks to every Harry Hardlock and Sally Sob story that gets you a phone call.
If you think that's bad, check out this next clip.
I'm not happy, Bob. Not happy. Ask me why.
Okay. Why?
Why what? Be specific, Bob.
Why are you unhappy?
Your customers make me unhappy.
What? You've gotten complaints?
Complaints I can handle. What I can't handle is your customers' inexplicable knowledge of Insuracare's inner workings. They're experts! Experts, Bob! Exploiting every loophole, dodging every obstacle! They're penetrating the bureaucracy!
Did I do something illegal?
No.
Are you saying we shouldn't help our customers?
The law requires that I answer no.
We're supposed to help people.
We're supposed to help our people! Starting with our stockholders, Bob! Who's helping them out, huh?
So now it should be completely obvious the similarities between the corporate CEO on the movie and the CEOs that run the capitalistic, real-life insurance companies. But I want to know what you think. Can the boss from this movie be an easy comparison to the heads of real-life private insurance companies?
I didn't see that clip till I got here today, so I was talking about in the opening, when you watch that, a lot of Nikki's story is in there. Now, I'm not here to demonize, business, but what I will say is that is the fundamental flaw in American healthcare, is that you have private companies that are involved in the process. And there is a fundamental conflict of interest because those companies are doing what they are supposed to do, and that is make money. That is their imperative. That is their legal imperative. That is what private business is in business to do, is to make money. And when you see marketing from private companies that are involved in healthcare, they're trying to provide care, which is not a legal imperative, alongside of that legal imperative to make money. That is a fundamental conflict of interest, and it will, in my opinion, it will never work. Oh, yeah, we talked about the complexity of insurance companies. And in order to solve it, we had this slide up last week. It's problem can be solved. Basically, the problem occurs is whether or not we're willing to address the issue. And along with being willing to address the issue, as Christians, we have in the Sermon on the Mount and in many other places in the Bible how we should approach this issue as the way of Jesus. Now, a couple of things that come up over the past couple of weeks, so or especially last week. There's a clue to that top question. There's no wrong answer. The answer probably is yes. But as far as it being in the Scripture, it's not in Scripture. I can just let people read that themselves, but we're not supposed to rely on ourselves. But that perception helps perpetuate this bootstrap individualistic culture that we have in America. Not that when we have an opportunity to assist in our care, to assist in changing our path, which Jesus does challenge us to turn away from certain paths that we're walking on. But it's trusting the Lord with all your heart and lean not on your own understanding. In all your ways, acknowledge Him, and He will make straight your paths. One of the other things that came up is poverty a mainstream experience? And by mainstream, I'm saying, do you think that poverty only occurs to a small portion of the population? A few people? Is it something that's fairly pervasive in the U.S. economy? Any thoughts? Worse than what we perceive it to be? Okay.
I think Rick's words that we think that someone's always in, but when you think of ever having experienced it, it's a whole lot of people.
Between the ages of 20 to 35, almost a third of us will experience 1 year under the poverty line, and I believe that's the 100% poverty line. Between ages 36 to 55, almost half of us will experience at least 1 year of poverty. Between the ages of 56 and 75, almost, what is that? 59%, but I was trying to think in thirds and it didn't work right now. Between the ages of 20 to 75, 68% of us will experience poverty below 125% of the poverty line, and 76% of us will experience being in a situation 150% below the poverty line. Now, I had a slide that showed what that meant in dollars and cents, but in my technological wizardry, I lost it.
So don't talk to him and about learning about technology.
However, I can say from the chart, and you can Google this, any of this information, all you have to do is go on Google and type it in. And there will be so many articles. The information is there. But if I remember right, the 100% poverty line for one person household is like $11,000 a year. So 150% of that is between $16,000 and $17,000 per year. How many people can really live on that and meet all of their needs and health care? It really doesn't work very well. One of the other things, somebody wrote on a card that many of the countries with these benefits have a much higher tax rate. If you look at, you compare Canada to America, and that's the text on the left-hand side, you can see the differences. Canada corporate tax is 16, American corporate tax is between 15 to 35, and I believe the 15% in America is capital gains tax. The federal tax on corporate income in the States is 35%. Individual income, Canada 15 to 29, U.S. 15 to 35. Canada doesn't have a Social Security tax. Presently, our Social Security, the total is 15.3%. It's a little bit less than that right now because 2 percentage points were taken off what the employee is supposed to contribute. A year or so ago, that was part of the stimulus. Canada has a value-added tax of 5%. Now, it's very difficult to compare tax rates across countries. So I included this chart on the right-hand side, and I don't know, can you read that very well? Okay, the top one is Denmark, and it approaches somewhere like around 48% of income. The average of what is known as OECD, and that is Organization for Economic Cooperation and Development. Their averages are about 36.2. The U.S. averages about 27.3%. Canada is about 33%. So, yes, the Canadian system taxes about 6 to 8% more than what we pay in the U.S., but we've been over the benefits that the Canadian people receive in past presentations here.
But they're paying for health care out of taxes. That doesn't count health care when you're looking at the U.S.
No.
Because we're paying out of pocket.
No, that doesn't include health care. So 6 to 8% more. They have better social programs, and they have health care paid for. And I will just use the example of the paid maternity leave in Canada, paid 50 weeks. Yes?
And everybody's treated equal.
Yes, everybody is treated equally.
Nobody has better insurance than the other. It's all where everybody can get the help that they need in the care.
Everybody drinks out of the same cup of health care coverage in Canada.
Which is how it should be in America.
One of the other things that came up was something about big government. And one of the things that we do rely on government for some issues. After 9/11, the government, and whether you like this or not, we rely on the government to take care of airport security. We also rely.
It is funny.
We also rely on government for national defense. They're involved in infrastructure development. They're involved in public education, and they are involved. There are regulatory agencies. What happens when government fails? I can say in the regulatory end of it, when they tried to deregulate electricity earlier on around the turn of the century, turn of the century, that we had Enron. If you want to see what it'll actually kind of turn your stomach, but the name of the movie about it is The Smartest Guys in the Room, which chronicles the rise and fall of Enron. But all the people